second wave of Covid-19 is wreaking devastation through the country with daily cases crossing 3.4 lakh and death tally above 2,500. With healthcare infrastructure gasping to cater to increasing needs, vaccination is the only way out. Nearly 11.5 crore people have received their first dose and over 2 crore have received their second dose. Yet, the pace of vaccination is not good enough. Only 1.4% of the total population has received both the doses. The centre has now rolled out phase 3 of COVID vaccination, where everyone above the age of 18 is eligible for getting vaccinated. But the cost of vaccinating for the 18 to 45 age group should either be borne by states or should be paid out of their own pockets to get vaccinated in private hospitals. Vaccine availability is going to be a challenge at least until July. While many states have announced free vaccines for all adults from May 1, others are complaining about the additional burden on their finances. Here's Business Line's analysis deciphering the cost of vaccination. The cost of vaccinating the 18 to 45 age cohort, when distributed across states, does not put too much burden on any state. The total cost of vaccinating the adult population will be 58,282 crore rupees. Of this, the centre may have to bear 10,234 crore rupees if it vaccinates all the willing population above 45 and healthcare and frontline workers. The cost to be borne by states for vaccinating all those between 18 to 45 years would be approximately 48,048 crore. States have to vaccinate a larger proportion of population and also have to pay a higher price for their vaccine procurement. Experts think that cost is not an impediment in vaccination. It's planning and execution that may cause hiccups. And this begs the question, shouldn't centre bear the entire cost as it had originally intended? 3 reasons why. 1. The union budget had set aside 35,000 crore rupees towards COVID vaccination for financial year 2022. The FM had promised that the allocation can be increased should the need arise. Only a third of this allocation is likely to be used for vaccinating those aged above 45. 2. The states have to set aside funds for medical infrastructure, testing and quarantining. Asking them to incur additional costs seems a trifle unfair. 3. Prevention of the extension from one state to another of infectious or contagious diseases or pests affecting men, animals or plants fall under concurrent list of the Constitution and is not the responsibility of the states. But do the states have the funds? While it does not seem equitable to ask states to bear the cost of vaccination, numbers however show that they will not have too much difficulty in funding this expense. The distribution of the vaccine cost of 48,048 crore across states would depend on the population of the state. Therefore, the largest burden will be on states such as Uttar Pradesh, Maharashtra and West Bengal. This cost amounts to less than a third of the healthcare budget in the more populous states. To read the complete story, click the link in the description box below.